Hi, I'm Dr. Ron Samoji.
And I'm Dr. Wakas Jalil.
The purpose of this video is to give you a brief overview of the procedure.
But remember, the most important first step in your surgical journey is a consultation, and we look forward to seeing you then. Mastopexy, or more commonly known as breast lift, is a procedure where we remove excessive skin that has developed over time in an effort to uplift or move the breast into a more rejuvenated or perkier appearance.
The ideal patient for a breast lift or mastopexy is one that is at their ideal weight, or at least stable weight, that's really bothered by a number of different problems with the breast. These can be deflation of the breast, where the upper part of the breast is quite empty. It can be droopiness of the breast or a low position of the nipple, and it can be the general look of excess or loose skin. Any of these issues can be improved upon with a mastopexy or a breast lift, depending on the type of procedure that's selected.
There are various incision options available for breast lift or mastopexy. In patients who only need a minor amount of lift, the options include a donut mastopexy or a circular mastopexy, where we make an incision around the nipple and then decrease the diameter of it. Other options or incisions include a lollipop or an anchor incision pattern. Each one is specific to the amount of skin that's required to be removed. There are also different adjuncts available during your breast lift or mastopexy procedure. A common adjunct that we do during the mastopexy is an auto-augmentation or a U-implant. This is basically a procedure where we take tissue generally from an area of the breast where you don't want it, such as the lower half, and then move it to an area where you do want it to improve upper pole contour or appearance of the breast to make it look a little bit more round or circular in shape. If patients don't have enough breast tissue, is to use an implant. This generally is to address the upper pole fullness again and to create a better breast shape. Another adjunct for mastopexy can also be liposuction. Generally, the liposuction is reserved for the lateral or side of the breast in order to create a more contoured or aesthetic appearance.
The general risks of any surgery include things like bleeding, infection, blood clots, anesthetic complications, some degree of discomfort or pain after surgery, and some downtime, your inability to do some of your normal daily activities or exercise for a period of time.
The specific risks related to mastopexy or breast lift include scarring. This is probably the more common risk associated with breast lift, since there are incisions being made onto the breast. There are varying options related to the scarring, such as the previously mentioned donut, lollipop, or anchor scar pattern. Each one is specific to the patient and needs to be discussed with them. Patients who are on the darker Fitzpatrick scale, such as African Americans, definitely have to have a discussion related to possibility of keloid or hypertrophic scarring. Other complications related to mastopexy involve asymmetry, such as one breast not looking completely identical to the other. A common thing that we say during consultation is that they're supposed to be near sisters but not identical twins. As expected with breast lift or mastopexy, with incisions there are changes to breastfeeding or nipple sensitivity. When we generally move the nipple areolar complex, we do interrupt the potential for breastfeeding and also for the potential for the nerves to regenerate, allowing for hyper or hyposensitivity to the nipple. Thankfully, these risks are low, and most patients do very well with this procedure. There can also be dynamic changes that happen to your breast over time. Age and gravity are undefeated, and as a result, you may see that the breast can descend or droop again, and if this occurs, you may require a secondary procedure or another uplift of the breasts.
The recovery from a mastopexy or breast lift depends specifically on the type of procedure that we do, whether it's a very big breast lift or a smaller breast lift, but in general, this is day surgery. Patients come in, surgery takes anywhere from an hour and a half to 2.5 hours, and the patient goes home right after surgery. Once the patient's home, they're usually in a recovery bra to hold everything in the position that we like, and that recovery bra is left on for somewhere between 4 and 6 weeks, depending on the procedure. During that time, patients return to all of their normal activities, things around the house, Most patients go back to work after a few days. Basic daily activities are no problem. What we restrict is physical activity, gym type activity, heavy lifting, things that are really exertional. And that's usually maintained again for about 4 to 6 weeks after surgery. Of course, we see patients during that recovery period and coach them as to what they can and can't do during that time. We expect the breast shape to fully settle by about 3 months, and we expect the scars to continue to heal and fade as much as they're going to fade for about 12 to 18 months. A breast lift or mastopexy can be done in a patient of any age with any degree of breast droopiness. In this example, an older patient, 64 years old, with severely ptotic or droopy breasts. You can see after surgery, shown at 6 months, that the breast is lifted. You can see that the scar is the Y pattern or anchor-shaped scar that we described, so a scar around the areola, down the front of the breast, and underneath the breast. That's the scar that's required for this degree of lift. Some of the things that we considered in this patient would have been an auto-augmentation or U-implant that would have given her a little bit of extra volume in the upper part of the breast, maybe a more youthful appearance. We could have also considered liposuction of the side of the breast to improve the contour in that area as well. But you can see after 6 months that she's uplifted and much more comfortable and confident with her appearance.